Have you ever heard about pregnancy EPULIS? No? Well, you are not alone. Pregnancy EPULIS, or as it's also known, pregnancy granuloma or pregnancy tumor, is a benign growth that appears on the gums during pregnancy. It's a localized swelling, typically appearing like a red raspberry-like lump on the gums. This growth develops in response to hormonal changes in your body, particularly the increased levels of estrogen and progesterone during pregnancy. It's most commonly seen during the second and third trimesters. Most of the time these growths are painless, but occasionally they can cause a bit of discomfort, especially if they interfere with chewing or brushing your teeth. Don't worry too much though. Pregnancy EPULIS tends to regress after childbirth. In some cases it may persist and require professional dental treatment. But remember, while it may sound alarming, pregnancy EPULIS is generally harmless. So, what causes this raspberry-like lump on the gums during pregnancy, you might ask? Well, the primary driver behind pregnancy EPULIS is the hormonal changes that occur during pregnancy. Pregnancy is a time of significant hormonal shifts, particularly the increased levels of estrogen and progesterone. These hormones, which are essential for maintaining pregnancy, have a profound effect on the body, including the oral tissues. When these hormone levels rise, they can cause changes in the blood vessels in the gums, leading to increased blood flow. This in turn can cause the gums to become more susceptible to irritation from plaque, the sticky layer of bacteria that forms on our teeth. If the gums become irritated, they may respond by swelling and forming a growth which we know as pregnancy EPULIS. While it's usually harmless, it can cause discomfort, especially during eating or brushing. It's fascinating how the body reacts to these hormonal shifts, isn't it? Now that we know what causes pregnancy EPULIS, let's discuss the symptoms and how it's diagnosed. Pregnancy EPULIS typically appears as a raspberry-like lump on the gums. It's usually painless, but it can sometimes cause discomfort, especially when eating or brushing your teeth. The growths are most commonly seen during the second and third trimesters of pregnancy, and they usually disappear after childbirth. However, there are instances where they persist and require professional dental intervention. So, how is pregnancy EPULIS diagnosed? If you notice any changes in your oral health during pregnancy, a dentist or healthcare provider can evaluate these changes. They'll examine your mouth and gums, and if necessary, take a biopsy to confirm the diagnosis. Remember, even though pregnancy EPULIS is generally harmless, any oral growth should be checked by a healthcare professional. If you're pregnant and notice any changes in your oral health, don't hesitate to consult your healthcare provider. Now we've covered what pregnancy EPULIS is, its causes, symptoms, and diagnosis. But how can we prevent it, you may ask? Well, it's all tied back to the same theme we've been discussing: oral health. Pregnancy EPULIS, or pregnancy granuloma, as we've learned, is a benign growth that can occur on the gums due to hormonal changes during pregnancy. It's most common in the second and third trimesters and usually regresses after childbirth. Though it's generally harmless, it can cause discomfort and in some cases may require professional treatment. The best preventive measure is maintaining good oral hygiene practices. Regular brushing and flossing, along with routine dental checkups, can help keep your mouth healthy and minimize the risk of developing pregnancy EPULIS. It's also important to have any oral growth evaluated by a healthcare provider to confirm the diagnosis and guide the appropriate course of action. Remember, your oral health is an important part of your overall health, especially during pregnancy. Stay aware, stay healthy.